Hello guys, welcome back to the channel. So this is a video where we'll be discussing the recall question of the today's FMGE exam, that is Jan 2023, held today on the 20th of Jan. So I have tried to include the recall question that happened in the morning. Okay, so this is basically the part 1. We'll be discussing remaining questions in the part 2. If you are new to this channel guys, please subscribe to this channel so that you continue to get some amazing videos. So let's get started. Okay, first of all they ask you the first question, that is about the tam horsefall protein. So this tam horsefall protein is basically a protein of the renal origin guys. Okay, and this is secreted by the thick ascending limb of the loop of Henle. So this may be a next year question guys. That is again important. It is secreted by the thick ascending loop of the limb of Henle. Now they ask you whether it is a cast or crystals guys. Okay, so let's have a look at the urine crystals guys. Okay, see, you have uric acid crystals, you have calcium oxalate, okay, this calcium oxalate crystals, you have monohydrate, okay, and that is bi. Okay, when you look at this calcium oxalate crystals guys, okay, monohydrate and dihydrate crystals. So when you look at this monohydrate, remember D is not for D, so this monohydrate crystals are dumbbell shaped, while this dihydrate crystals are envelope shaped. Okay, then you have triple phosphate crystal that looks like a coffin lid guys. Okay, so this is calcium bicarbonate crystal, this is ammonium biurate crystal, so it looks like a thorn appearance guys. See, this is the appearance, spherical with protrusions. Okay, then coming on to other crystals that are important guys. Okay, see, we have the crystal, see, this is done triple phosphate coffin lid ka crystals. Then this cholesterol crystal guys. Okay, so you have rectangular plates and you have the presence of notches, that is again important. Then this uric acid may be of any shape, okay, most commonly diamond shape. Then you have tyrosine. Okay, so remember, see, tyrosine, that is Ni is there guys, that is the scissor needle shaped crystals. Okay, then coming on to some other guys, cast. Okay, if we talk about the cast guys, that is WBC cast. WBC cast is seen in pyelonephritis and other causes. Epithelial cell cast, RBC cast in nephritic syndromes. Okay, then you have mixed cast, then granular cast, hyaline cast. Okay, then renal tubular cast, that is important. Then you can have epithelial cell, pus cells, or the red blood cells in the urine. So this was all about your tam horsefall protein, cast and crystals guys. Okay, in this video we are not only discussing the questions that was asked in today's exam, but the questions that may be asked in the upcoming exam guys. Okay, so we'll have a look at that also. Now the next question guys. Okay, I don't know, gout, they had so much love for gout, they asked 3 questions on gout guys this time. Okay, so see, when we talked about the gout guys, if you remember guys, this question I have discussed the same thing guys. Okay, and they even ask you about the birefringence guys. Okay, so if we look at this guys, gout, one is the gout guys and one is the pseudo gout. Okay, so this time they ask you pseudo gout guys, where they gave you a Nika history. Okay, so see, when you look at this pseudo gout guys, they are your positively birefringence guys. Okay, and they look blue when passed parallel to the compensator. Okay, so this pseudo gout is not due to this monosodium urate crystal guys. Gout is due to monosodium urate crystals. Okay, that is basically a defect in the purine metabolism. So here when you look at this monosodium urate guys, they are negatively birefringent guys. This is very important guys. Okay, needle shape, remember, any needle shape, any for negatively birefringence guys. Okay, so this time they ask you this question, that is again important. Okay, this can be. Now coming on to the management of gout. So okay, we have acute gout, we have chronic gout. Okay, so guys, remember the acute gout, the drug of choice that we remember, allopurinol guys, it's used only for a chronic gout, not for acute gout. Okay, acute gout is basically anti-inflammatory condition, so we need to reduce the pain, so we will give NSAIDs guys. Okay, we can give all except your aspirin and paracetamol because they are contraindicated here. Okay, if it is not responding guys, we will go to colchicine. So this colchicine is a microtubule inhibitor guys. Okay, and the advantage that it is very fast acting drug and it inhibits the migration of WBCs, but it can lead to GIT also. That is the problem with your colchicine. Then coming on to corticosteroids, if colchicine does not act, right? If there is chronic gout, okay, so when we look at the path, we have hypoxanthine to xanthine guys. Okay, that conversion is with the help of enzyme xanthine oxidase. So if we inhibit this enzyme guys, so uric acid formation will decrease. So that is with the help of exo inhibitors, guys. Allopurinol, then you have oxypurinol, febuxostat, see exo coming in the name, guys. Okay, so this was the first question, guys, xanthine oxidase inhibitor. So see, then what you can do, in like if you see at the birds and some mammals, guys, this uric acid is converted into allantoin, guys. Okay, so that is by the help of uric acid oxidase enzyme. So you have two things, one is the pegloticase and one is the rasburicase, guys. Okay, also you can increase the uric acid excretion in urine, guys. Okay, when you increase the uric acid excretion, as a result less amount will be there in the blood. As a result, chances of gout would decrease. So this time they ask you probin acid, guys, and also you have sulfenpyrazone. If you recall, guys, when I have done the last minute revision and the BTR series, guys, same thing I said you, guys. Okay, we have allopurinol and we have proban acid, which is the uricosuric acid, guys. They ask you this time this question only. Okay, if you have watched my previous videos, guys, do comment how helpful were they in your exams. See, this is rhomboid crystals which are positively birefringent, means that is pseudogout, and it is due to CPPD, that is calcium pyrophosphate dihydrate crystals. If there is needle shape, that is negatively birefringent, guys, that is due to gout, that is monosodium urate crystal. And what is the typical history, guys, that I taught you? So you will have first tarsometatarsal joint, guys, you have swelling. Okay, that is goutophaceous swelling. Last time they showed you this question, guys, and the question was again allopurinol. So you know, it's basically a way of asking, guys, something else. Okay, the question is same, just when you read, PYQs are definitely important. Just have a look in and around the PYQs, guys, what can be repeated for your exam. See, if we are doing gout, it won't be fair, guys, if we don't complete rheumatoid arthritis at this point, guys. Okay, because if this time they ask you gout, next time rheumatoid arthritis very likely. See, then acute rheumatoid, again we can do NSAIDs and you have corticosteroids, guys. Okay, but the definitive management is the DMARDs, guys. What are DMARDs? That is disease modified anti-rheumatic drug, guys. So you have biologics and non-biologics, guys. Biologics, when it acts along a certain receptor, guys. Okay, like anti-TNF alpha receptor, guys. So you have 5 drugs, guys. The mnemonic for anti-TNF alpha is IKs. Okay, sorry. So I means infliximab, C means certolizumab, E means adalimumab, G means golimumab, and E means etanercept, guys. Then coming on to interleukin 6, guys. Okay, so we have 2 drugs, guys. One is the sarilumumab and one is the tocilizumab. Then coming on, guys, to the next one. Okay, so this you can 6, you can remember 60. Okay, S for sarilizumab and T for tocilizumab. Then rituximab, guys. This is one of the most favorite question that asks here and there, guys. Okay, that is your anti-CD20. Anakinra, guys. Okay, that is interleukin 1 receptor antagonist. Now abatacept, guys. This is receptor CTLA4. Then you have tofacitinib, baricitinib, guys, which are JAK inhibitors. Okay, that is again important. So what are the other non-biologics that are used as DMARDs, guys? That is methotrexate, guys. That is an anti-cancer drug. So it inhibits the enzyme dihydrofolic reductase, guys. Okay. Also in low doses it inhibits adenosine reflux. But the problem is that it can cause pancytomania, bone marrow depression. Okay, see, bone marrow suppression, hepatotoxic. So always before administration, guys, you need to check your liver function test before administration of drug. Then antidote is folinic acid. Like this time, if you see the next question, guys, they ask you which antidote of iron. That is your deferrioxamine. If you might have watched my last minute revision series, the same table I gave you guys before the exam to revise it, and you can see the questions came. Okay, so see, then you have sulfasalazine, guys. So you remember, like, we have sulfasalazine, olasalazine, guys, which were used in your ulcerative colitis, Crohn's disease wala thing, guys. See, also in ulcerative colitis, do you see mesalazine and olsalazine, guys. Okay, then you have penicillamine, which is a copper chelator, guys. Okay, so this is used in your Wilson disease, guys. That is penicillamine. So see, copper pen, guys, penicillamine. This also I taught you. Then gold. Okay, then your leflunomide, guys. Okay, so this leflunomide inhibits the enzyme dihydroorotate dehydrogenase, which inhibits the pyrimidine synthesis. Again important. Chloroquine, hydroxychloroquine, that causes bullseye maculopathy, guys, opthal co-integration. Then they ask you, guys, iron antidote and iron caistin, guys. Okay, iron antidote, see, deferrioxamine, name only Fe is coming, guys. Then the next question that can be asked, that is malignant hyperthermia, guys. That is your dentrolin. Then you have OP poisoning, guys, that is atropine. Then tricyclic antidepressant, guys, that is sodium bicarbonate. Then this question is so many times repeated, guys, I cannot stress on the fact. This is again a PYQ. Benzodiazepine, that is your flumazenil, guys. Methanol, that is your ethanol, guys. Okay, then beta blockers, guys, that is glucagon, again PYQ, guys. Then digoxin, guys, that is antidigoxin, guys, this is known as your Diziband, FAB. Then this is again a repeated question, guys, that is acetaminophen, guys. Okay, paracetamol toxicity. What do we give, guys? They will give you N-acetylcysteine in the answer. Then lead, guys. Okay, if you rearrange the letter, guys, that can become EDTA, that is ethylene diamine tetraacetic acid. If you have carbon monoxide ka poisoning, guys, okay, will give excess of oxygen, that is 100% oxygen. Then amphetamine, guys, if you have the poisoning, then we give ammonium chloride. Mercury, guys, then that is dimercaprol. They may give you like Minamata disease, guys, due to mercury poisoning, something like this. Okay, then cadmium, guys, it is Itai disease, guys. Then phenothiazine. Then you have cyanides. So this is about. Now coming on to iron stain, guys. If you might have seen my path video, the last video that I uploaded before your FMGE exam, so many questions were from that. See, this was the list I gave you, guys. Iron, guys, it's pulse Prussian blue or the hemocentrin, guys. Also, we have a look of all the stains, guys, that were given, and this was the image also which I showed you, guys. See, acid fast stain, that is Mycobacterium TB lepra positive, Conger red amyloid, guys. Okay, and it shows apple green birefringes on a polarizing microscopy. Von Casa for calcium, guys. Okay, also we have calcin and alizarin red. Okay, then you see pulse Prussian blue, hemocentrin used to stain iron, guys, the same thing that was there in your today's paper. Then you have Gomri methamine silver stain. Okay, this is India stain used to stain the polysaccharide capsule. Periodic iodic, that is pass positive and that is sensitive, guys. Okay, Alcian blue for mucin, this is again a PYQ. Then you have neurofibrillary tangle, guys, that is seen in your Alzheimer's disease. Then ward of Wien-Giesen disease used for elastic fibers. Then your Orsin cicata stain for elastic fiber and also for hepatitis B organism, guys, HBsAg. Oil redo for lipid, guys. This was last year question. So we finished, we had a look on staining, guys. Now moving on to the next part, guys. This was done in my triads video and also in biochem video, guys, if you had watched it. Vitamin B3 deficiency. I said remember B3 for D3. That is B3 is niacin, guys. Okay, they ask you niacin causes what 3D. That is your D, diarrhea, dementia and dermatitis. And also what is the most classical image that they show you, guys? That is your Casel's necklace. And if not treated, this may lead to the fourth D, that is death, guys. See, this was again discussed even in the last minute revision video, guys. See, the same thing. Three Ds: diarrhea, dementia, dermatitis, guys. You have pellagra, niacin, vitamin D deficiency. Okay, now coming on to the next one, guys. Okay, that is your tyrosine. Melanin is formed from tyrosine, guys. That gives the pigment, and this tryptophan, this forms the serotonin. Okay, this we have discussed again in our biochem ka video. This tyrosine ka catabolism, we have phenylalanine to tyrosine, guys. That is due to enzyme phenylalanine hydroxylase. If there is deficiency, that is known as your phenylketonuria, where you have mousy odor of the urine. Then tyrosine is converted into dopa, guys. Okay, and the enzyme is tyrosine hydroxylase. Okay, dopa is converted into dopamine with the help of enzyme dopa decarboxylase and also requires vitamin B6. Okay, then dopamine can also be converted into dopaquinone, then to melanin, guys. Okay, if there is deficiency, that is known as albinism. So this is very simple. Then they ask you below the umbilicus level, guys. Okay, this everyone remembers, guys, at the level of T10 is the umbilicus. So below, definitely it would be something below the T10. Then they ask you chemotherapy induced vomiting, guys. Okay, so the most preferred drug is this serotonin receptor antagonist, that is 5-HT3 antagonist, guys. That is Cetron's wala drug. That is ondansetron, granisetron, palionsetron, something from this can be answered. But let's see the other drugs that may be used, guys. That is neurokinin 1 receptor antagonist. That is tant wala drug. Okay, apripitant, neuropitant, guys, pitant wala drugs. Okay, then coming to combination of both, guys. Okay, that can be given corticosteroids or olanzapine may be tried, guys. Okay, then the next question, guys. This also discussed in our pharma video, last minute revision video. I cannot stress, guys, how much important. And also, if you remember, guys, this was the table that I posted, I think, one day before your exam. Okay, one or two question will be definitely from here, guys. Okay, so let's see whether my prediction came true or not. Okay, so Reed-Steinberg cell. So this Reed-Steinberg cell, guys, that is seen, that is all eye appearance, guys. Okay, that is seen in your Hodgkin's lymphoma. It's CD5 positive, 15 positive, 30 positive and PAX5 positive, guys. But I said if you remember guys, this Reed Steinberg cell E for eosinophilic guys, okay, but this is also associated with your infection, that is cytomegalovirus infection guys, but here it's basophilic. So this was this year question guys, okay, they ask you both the questions, so again you can see how important it is. Now coming on to meningioma guys, okay, when we talked about the brain tumor guys, this meningioma, okay, this has a psammoma bodies guys, if you recall, and I talked about the whirling appearance of the tumor cell. See, in my last minute revision, wall like arrangement, you have at two places guys, one is the meningioma, one is the fibroid, that is your leiomyoma. Okay, so see, this is meningioma which has whirling, and also this shows the presence of your psammoma body guys. This is the mnemonic for psammoma body. See, everything in the name guys. P for papillary carcinoma, P for prolactinoma, S for serous ovarian tumor, S for somatostenoma, okay, M for meningioma, M for mesothelioma. Done guys, okay, and this is also ER receptor positive guys. This may be a future question guys, again important. Okay, now coming on to the next thing guys, see this Reed Steinberg cell, again I said guys, okay, that was there. Now coming on to the important findings in all the tumor guys, okay, so because when meningioma is asked, next time something else will be asked, so we need to be, sorry, this is basically PR receptor positive, so sorry guys, okay, this meningioma is PR receptor positive. Then coming on guys to the next one, that is pilocytic astrocytoma. So here you see is the rosenthal fiber, that is glial fibrillary acidic protein positive guys, okay, and this is again important. Then you have GVM guys, that is glioblastoma multiforme is not used now guys. So you have the presence of serpentine necrosis and the glomeruloid bodies. This is again important here. This also we discussed in the last minute path video. Then oligodendroglioma, you have fried egg, you have chicken wire blood vessel, this also done, and you have presence of calcification. Ependymoma guys, you have perivascular pseudo rosette guys. We talked about the true rosette, pseudo rosette, and perivascular rosette guys, if you remember guys, that flexner Winster is seen in retinoblastoma. Then medulloblastoma guys, you have homerite pseudo rosette, okay, that was in medulloblastoma. Ewing sarcoma guys, okay, neuroblastoma. Then meningioma, you see the presence of psammoma bodies and also whorled pattern. Schwannoma guys, you have varico bodies, Antony A, Antony B bodies guys, okay, that is again important. Then coming on to the next question, they ask you gas gangrene organism implicated guys, okay, so this is the table from the first aid that we discussed guys. It is due to Clostridium perfringens. It produces alpha toxin lecithinase guys, and also this produces a reaction guys, that is your Naegler's reaction, if you recall it guys, okay, again important. Then they ask you ochriotride guys, okay, how did they ask you? They ask you what is the treatment in acromegaly guys. If you remember how I ask you to read it guys, that tide and C are related guys, okay, in the C you will see the presence of tide, okay, so the mnemonic for ochriotride uses was the C. S for secretory diarrhea, E for esophageal breezes, and A for acromegaly, and you see the question gets solved. Okay, then coming on to the next question guys, that is TPTC stain they ask you, that is triphenyl tetrazolium chloride. If you might have recalled that this was the table that I did in guys last minute revision for your path guys, okay, do you remember it guys? I said you I forgot to include the image guys, but in MI there is a very important stain, that is TPTC. You can see it's written also, most important MI TPTC stain guys, that is triphenyl tetrazolium chloride stain guys. So this is basically, this is the image showing, this is the image that is most popularly available everywhere guys, okay. So basically what happens, there is a flipping of LDH guys, okay, that is the problem here guys, okay. So in myocardial infection you see that it turns, there is a change in color guys, okay, due to flipping of LDH, due to death of the cells. Then the next question guys, they ask you about the ulnar nerve injury guys. So they may have asked you either of the test guys, okay, so you have book B, C, D, if you remember the mnemonic guys, B, C, D, book test, card test, Foreman's and Igawa test guys, okay, that is important. Ulnar nerve supplies 1.5 muscle of the forearm and 15 of the wrist guys, okay, if you remember guys, hand muscles. And ulnar nerve injury guys, what does ulnar nerve injury cause? It causes a claw hand guys, okay, that is again important. Ulnar nerve will cause claw hand. Okay, this is again other nerve injuries guys that has been discussed here. Then talking about then the next question, the one question they ask you on the case control study guys. So you remember this was the case control study, is how I discussed guys, okay. So this case control study, okay, this is basically a retrograde study guys, okay. Here we move from here we move from present to the past. We are going back in time, guys, and we are analyzing it. That is important in your case control study. See, both exposure and outcome has occurred, guys. This is a retrospective, backward looking study, effect to cause study. We are moving back in the time, guys. Okay, so we do not need to follow up the patient, guys. So it's easy, rapid, inexpensive, and there is no loss to follow up. Okay, but this estimates the odds ratio, guys. That is the cross product ratio, that is AD by BC. Okay, see, then we have discussed how to calculate odds ratio, and also odds ratio more than one positive association equal to one no association, and also we discussed few MCQs, guys. Okay, then coming on to the next topic, they ask you the topic of prevention, guys. So we have primordial prevention, primary prevention, secondary prevention, and tertiary prevention, guys. Okay, so see, primordial prevention, guys. Basically what we do here now, we risk factor has not emerged in the life. We ask the patient from the starting only, like when his child 3-4 years old, we'll ask him to exercise, have a healthy lifestyle, avoid Maggie pizzas. Okay, that is primordial prevention. So basically here we are promoting the health, guys. Okay, so health promotion. Then coming to the primary prevention, guys. Okay, what do we do here in the primary prevention? We basically prevent the onset of the disease, guys, in the primary prevention. Here we prevent the development of risk factor, guys. Okay, here we prevent manage the risk factor. Okay, prevent the onset of disease here. That is a specific protection. Example, we take vaccination, guys. Why? Because we need to protect it. That is primary prevention. Then coming on to the secondary prevention, guys. Okay, secondary prevention, basically you need to diagnose it early, so that you can treat it better. That is early diagnosis and treatment is the secondary prevention. Then tertiary prevention, basically you need to limit the disability that is caused, and then you need to rehabilitate the patient. So aim is reducing the complications, guys. Okay, like suppose a leprosy patient using a crutches to walk, guys. Okay, something like that. Okay, then secondary prevention, early diagnosis and treatment, like using a for screening method. Okay, like we are doing a pap smear as a screening technique. That is important. Then they ask you the fluorine, guys. Okay, so the normal fluorine is 0.5 to 0.8, guys. This is all taken from your parks. So this fluorine, if you read the parks, guys, they have written very carefully. This fluorine is a double-edged sword, because excess will also cause problem and limit will also cause problem. So it can cause either dental caries, or may cause in excess it may cause your dental and skeletal fluorosis, guys. So dental fluorosis when it is more than 1.5 gram per deciliter, and when the exposure is early in the life, guys. So this is how it appears, guys. Okay, a skeletal fluorosis, if it is more than 10 milligram, guys, it can also cause your crippling fluorosis, guys. Okay, and this is genovalgum seen in patient whose staple diet is sorghum or jar. And here the next question that is important, guys, how do you defluoridate the water? That is by the Nalgonda technique, that is developed by the NERI, guys. Okay, National Engineering Research Institute, guys. Okay, National Environmental Engineering Research Institute. Then the next question they ask you that the multiple myeloma, which is lytic bony lesions, guys. Okay, so multiple myeloma, what are the things that are important? One is the slim criteria, crab criteria. S for 60% bone marrow plasmacytosis. Li for light chains, guys. M for MRI showing more than one focal lesion. Then this criteria is very important. That is your crab criteria. C for calcium elevation, means hypercalcemia. R for renal dysfunction. A for anemia. B for bone lesion, that is multiple punched out bony lytic lesion, guys. Okay, so see, basically here you see the presence of a spike, guys. This is the lytic bony lesion, guys, and here you see collapse of vertebra. See, the same question I discussed, guys, in last minute. Lytic punched out seen in multiple myeloma, guys. Okay, multiple myeloma usually shows IgG or IgA, guys, and Waldenström, I said W coulter, that is M. Okay, and here you see the presence of Rolex formation, high ESR, guys. Okay, and here if they ask you according to the histopathy, guys, it may show Mort cell, Mudbury cell, Rolex formation, where you see the cells, okay, sticking it to each other. Then you have Dutcher body seen in DNA, Russell's body RNA, and flame shaped cells. Then the next question they ask you on the basis of graph. Okay, so when they ask you on the basis of graph, guys, if you remember, I said non-competitive, remember no change in Km. Okay, so the Km is constant. So here the Km in competitive will increase, guys. Okay, here the Vmax will be constant. Here the Vmax will decrease. Okay, that is important. So see, this was the same graph that we did from our first aid book. Okay, when we talked about the competitive and non-competitive inhibition, guys. Okay, so have a look at the graph, guys. Okay, the same thing was done, and I said for this line weaver work plot, I said, remember, it's very easy to identify, guys. The one which crosses, guys. Okay, the uninhibited one is the competitive one. Non-competitive do not crosses. That is very easy, guys, than this question. Then coming on to the next topic, they ask you, guys, that is your PPAR alpha receptor, guys. Okay, so this receptor, they belong to the drugs of glitazone wala category, guys. Okay, so we have rosiglitazone, but the problem is that it causes MI, hence banned from the market. Then we have pioglitazone. Okay, it can worsen the CSM. Let's look at some other drugs, guys. Okay, so this metformin, guys, you might have remembered this mnemonic most. Metformin is used in thick patient, obese patient, and sulfonylurea in thin patient, guys. Okay, and also they ask you which drug causes weight gain, guys. So let's see a very easy mnemonic for this weight gain. That is SIT. S for sulfonylurea, I for insulin, T for thiazolidinedione, that is TZD. Okay, then coming on to this canagliflozin and dapagliflozin, guys, this is SGLT2, that is sodium glucose co-transporter ka inhibitor. So they will cause glucose loss in the urine. As a result of increased glucose in the urine, guys, chances of bacteremia and infection are high, leading to UTI and vaginal candidiasis. Then coming on to this tide, guys. Okay, exenatide and liraglutide, that is GLP-1 agonist. Okay, and see, GLP-1P, that is pancreatitis. Okay, then DPP4, guys, two P's, guys, one will cause nasopharyngitis, one will cause pancreatitis. Then chlorpropamide, that is the first generation sulfonylurea, like, okay, you have tolbutamide and chlorpropamide. Okay, that is your hypoglycemia disulfiram reaction. Okay, and ADH like action. And what are the drugs that leads to reduction in cardiovascular mortality? That is your GLP-1 agonist, SGLT2 inhibitor, and metformin. Then they ask you newborn ka neonatal resuscitation program if heart rate is less than 60. I have made a complete video where I have also demonstrated how to do a neonatal resuscitation. Then Duchenne muscular dystrophy, guys. Okay, that is a autosomal dominant, guys, and that is due to dystrophin gene. See, same thing we have discussed, guys. Muscular dystrophy, most common Duchenne, due to frame shift mutation of the dystrophin gene, guys. Okay, have a look. The same thing has been discussed, guys. Okay, we have two types basically: Duchenne muscular dystrophy, guys, and Baker's muscular dystrophy. Okay, that is important. Then coming on to next one, they ask you McNaughton's rules, guys, that is IPC. So this is section 84 IPC. So what does this IPC says you? Nothing is an offense which is done by a person who at the time of doing it, guys, by reason of unsoundness of mind, is incapable of knowing the nature of that, or what he is doing is what he is either doing or is contrary to the law, guys. Okay, they ask you this question, that is section. So this is a summary table explaining you all the IPC, guys. Let's see whether this question was there or not. Insanity, that is section 84 IPC, that is MN rule, known as your McNaughton's rule, guys. Okay, so let's have a look at IPC also today, guys. Okay, let's finish it for you. So Indian Penal Code, guys, when we talk about, so basically you have 44, 45, 46. So basically they gives you a definition of ILD. Remember, ILD, that is injury, life and death, guys. Injury is any damage to the person caused in the body, mind, reputation or property. Okay, then coming on to criminal responsibility, guys. Okay, that is around section 80 to 90 ka IPC. Okay, so is 82, guys, less than 7 years, who is not liable to crime because he does not understand the thing. 83, 7 to 12 year, and liability depends on maturity, guys, and that will be assessed by the court. Then insanity, 84 done. Intoxication, guys. Okay, that is you are toxic. Remember, 5 toxic. Okay, 5 letter toxic and 5 is toxication. Involuntary, your friend has made you drunk and you have done something wrong. Then 86, voluntarily, if you have drunk, guys, and you commit something wrong, so you are liable to be punished. Then coming on to consent. So minimum age for consent, guys, in major procedure is 18 years. 89, minimum age for consent 12 years. Okay, physical examination less than 12 years, parent guardian permission required. Then section 90, guys. Okay, consent is consent given under insanity, guys, when you are not sane, when you are under the influence, when you are intoxication, that is invalid consent. Then section 92, guys, not so important. Then coming on to this, guys, this is very frequently repeated. Section 195 defines perjury. Section 193, punishment for perjury. Section 7 for certificate. Section 197 punishment for issuing false certificate. 7, that is maximum 7 years ka punishment. Section 201 guys, okay, punishment for disappearance of an evidence cause intentionally guys, okay, like you do not you remove something in your autopsy guys, that was there, okay. Then you have basically some adulteration sale guys, okay, many other things guys, okay. Then they may ask you guys, that is murder guys, culpable homicide accounting to murder. Definition is in section 300 IPC and punishment is in 302 IPC guys, okay. Then this is again important, that is your grievous hurt given in your definition 320 IPC guys, okay. That is again important, they may ask you. Then this is your vitriol, that is also known as acid attack, that is 326 A ka IPC. B means basically attempt of vitriol, that is again important, okay. Then this is magistrate inquest, it is according to the 176 criminal penal code, and police inquest is the 174 penal code. So remember, magistrate is bigger than police, hence 176, okay. Then kidnapping guys, okay. So kidnapping, this are not this is again important. Section 375 defines rape and section 376 gives the punishment for rape guys, okay. So basically you have A, B, C, D guys, okay. So basically A, that is rape victim dies or he goes into a permanent vegetative state, okay. Then you have A, B guys, okay, that rape of a woman less than 12 years. Then you have B guys, okay. So basically this is various the gang rapes ka punishment, okay. Then this all are important guys, okay. So then grievous hurt, section 320 IPC guys, okay. So basically any hurt that causes emasculation, that is loss of potency, okay. Patient of vision problem, okay, hearing problem, any major problem, that is any member of a joint guys, that so that you cannot move, power of a member of a joint, dislocation guys, okay, any hurt endangering life, that all are classified under your section 320, that is your grievous hurt guys. Then coming on to this kwashiorkor and marasmus guys, okay. So have a look at this table. This kwashiorkor name contains O, that is edema is there. Marasmus, that is mara hua sa bachcha guys, okay, that is very thin bachcha, okay. And this, if you look clinically guys, this marasmus is much more common than your mota sa bachcha, that is your kwashiorkor. So kwashiorkor is seen in children guys, okay. Remember this, the diet are deficient in protein, they ask you this time this question guys, okay. Protein, if it is both protein and calorie guys, that is mara sa bachcha, that is marasmus, okay. Then here the subcutaneous fat is preserved because it is mota, but here it's not preserved. Here you see edema is present, bada bachcha, mota bachcha, that is enlarged fatty liver. Ribs are not very prominent. Look at so marasa bachcha, so his ribs is prominent guys, okay. This bachcha, though he is marawa, but he is alert and irritable guys, okay. And this is more common. Here the prognosis is better. भगवान ने वही चीज ज्यादा बनाया, whose prognosis is good, okay. He is मतलब alert and irritable, so he will feed well, that is voracious feeding. He does not feed well guys, okay. That is again important. And also they may ask you guys, this kwashiorkor shows the presence of your flag sign, flaky pen dermatosis. They may ask you this question again, okay. So this was all about this first part guys, okay. Soon I will be uploading the second part. Do comment guys, how did your exam went overall. If I say the first question, the whatever review I got guys, that the paper was comparatively easy. So do share your review. If there are some new questions guys, some new option, you may put it in the comment guys. Would appreciate your effort. And if the channel has helped you guys, okay, please do comment guys. And this is all for today. If you are new to channel, please subscribe to the channel. Happy learning guys, best of luck.